Hey Houston Baptist University, my name is Maria Castagnetti,
My name is Shelby Harris.
My name is Onome Larry Umakwara.
and today we're going to be talking about pneumonia. Okay guys, so before we start, we want to really talk about what is pneumonia and what does that look like. So right here we drew two pictures. One is a set of healthy lungs and one is a set of lungs that are affected by this disease. So this one right here, as you can see, the trachea is clear, the bronchi are clear, and the alveoli are clear. So this is good because this allows oxygen to come in, and right here in the alveoli, that's where gas exchange happens. So as oxygen comes in, carbon dioxide is able to leave out of the respiratory system. So that's what we want. But right here, these are the lungs that are affected by pneumonia. And as you can see, the alveoli right here have a lot of mucus secretions in them. And so this happens because when the pathological organisms enter, they get to your alveoli if they pass all of the immunological defenses of the body. And so once they get to the alveoli, you're going to have a flood of neutrophils trying to fight that pathological organism. And what's going to happen is there's going to be a buildup of edema and a whole lot of mucus production in the alveoli. And so that is going to interfere with the gas exchange. So oxygen is not going to be able to be picked up as well, and carbon dioxide is not going to be able to leave the lungs as well. And then that's when you start having problems. To move on, we're going to now talk about the incidence and the prevalence of pneumonia. So for this project, we're mostly focusing on community-acquired pneumonia. So that's where we're going to be going. A study showed that the incidence of community-acquired pneumonia increases as you see an increase in age. So obviously the older population is going to have a higher incidence of community-acquired pneumonia. They found that the annual incidence of pneumonia in 2015 was found to be 24.8 cases per 10,000 adults, with the highest rates in adults in the age group of 65 and 79, and then those higher than 80. Another study also showed that community-acquired pneumonia is found more in the African American population. Women are less likely to get pneumonia, and then there's really not a genetic factor that affects your risk of acquiring this disease. So since we are in the community-acquired pneumonia, especially here in Houston, one of the populations that it affects the most is the homeless population. And so that's where we're going to be focusing even more with this project. The Houston Coalition for the Homeless is a private nonprofit organization that is there to serve the homeless. They found that there's about 3,200 homeless people in Houston. So as we know, the homeless are more likely to gather in the inner city. So as we get closer to Houston, we're going to see more of this population. So how does that relate to us, the HBU community? So our thought was we are more prone to encounter this population. As you can see, if you leave campus, you're going to be able to see a lot of homeless people around here. And so the one goal is to educate ourselves on this topic, so we're able to serve the community in that way, and we can be cautious of this disease in the community that's going on. So we're going to move on to signs and symptoms of pneumonia. So you're going to see a cough, fever, chills, dyspnea, tachypnea, and chest pain. And that's because you're not able to move oxygen and carbon dioxide as it should. So you're going to see these problems. You may have a productive or non-productive cough. Your sputum might be green and yellow, and that is going to be an indication of the infection, or it might even be bloody. In the older population though, and that's like where we're going to see more of this disease on, they usually don't present with these signs. They're going to present more with confusion rather than the ones that I just listed. And they say it might be due to hypoxia, so they might get confusion. Another thing you're going to see is they're less likely to develop a fever, so you might actually see hypothermia instead. And then with pneumonia, you're going to be able to hear fine or coarse crackles throughout the lung area. So that is the basis that you should know about pneumonia.
Adding to what Maria said, now I'm going to talk about the risk factors. Many factors increase our chances of getting pneumonia. It includes age, environment, lifestyle habits, and other medical conditions. Age. Pneumonia affects people of all ages. However, two age groups at greater risk. Infants 2 years and below, their immune system are still developing, and then people who are 65 years and older, just as Maria mentioned earlier. Environment. Our risk of getting pneumonia increases because we live in Houston. We are being exposed to chemicals, pollutants, and toxic fumes. Lifestyle habit. Smoking, excessive use of alcohol also increases our risk of getting pneumonia. Other medical conditions can also increase our risk, such as lung disease, as asthma, COPD, and then those that have weak or immunosuppressed system can also increase your risk of getting pneumonia. Now we're going to talk about diagnostic tests. How do we test for pneumonia? Normally, the healthcare professional does this by medical history, which is asking you about your signs and symptoms so as to know if that's related to pneumonia. It could also be physical exam by auscultating your lungs to hear crackling, bubbling, wheezing, or maybe absent sounds. And then test result also, it could be chest x-ray, it could be sputum, it could be blood tests, and it could be blood culture. Complications associated with community-acquired pneumonia, it could be the pulmonary that has to do with your lungs, and then it could be acute respiratory failure, or it could be pneumothorax. It could also be metastatic, where it spreads to other parts of your body, and then it could be systemic, where it could be sepsis. People can ask, is pneumonia contagious? Yes, it is. We live in Houston, it's densely populated. If somebody that has pneumonia sneezes, coughs, and we around there and then we inhale it and breathe it in, we can get pneumonia. How can we prevent pneumonia? The major way we can prevent pneumonia is immunization. Everyone 6 months and above should get immunized against influenza and pertussis to prevent community-acquired pneumonia. And then parents and caregivers that take care of infants that are 6 months and younger can get immunized against pertussis and influenza also to protect the infant from getting community-acquired pneumonia.
Adding on to Onome's information, we're going to talk about treatment a little bit more in depth. So she had already started discussing about immunization, which is key and the most important treatment that we can do for pneumonia. So we're going to talk about the preventative vaccine for people who are 65 and older. This is the pneumococcal vaccine. So like I had said, 65 years and older. It can also be for people ages 2 to 64 years old, and these are people with long-term health problems that are chronic or they're immunosuppressed. And just some examples of this are cardiovascular disease, chronic pulmonary disease, sickle cell, diabetes mellitus. To keep on adding to that, we also have leukemia, we have cancer patients. So all of these people who have chronic diseases and conditions, they're more susceptible to infection. And this is a key reason that they need to be getting the pneumococcal vaccine. Not only that, but people who smoke. And we already talked about this being a risk factor, especially in the population around Houston with air pollution. Not only smoking, but that pollution. So people ages 19 to 64 who smoke and kind of are in this polluted area, they need to be getting the pneumococcal vaccine as well. And there's also revaccination, and that's for people who got the vaccine before they were 65 years old and 5 years has already passed. So that's just another key thing for treatment. So now that we've talked about the immunizations, we're going to go more in depth about treatment if people get pneumonia. So a total treatment of time for patients with community-acquired pneumonia, it's going to be a minimum of 5 days. And the medications that they will be receiving first is going to be the empirical antimicrobial therapy. And this may consist of macrolides, fluoroquinolones, beta-lactams, and anti-pneumococcal medications. And some examples of these are erythromycin, levofloxacin, and high-dose amoxicillin. And these almost always cure bacterial and mycoplasmal pneumonia. The indications of improvement for this, so if the patient is getting treated for these things, to look for their progression and healing, we're going to be looking for a decreased temperature, improved breathing, and reduced chest pain, just like Maria was saying earlier about the key symptoms. We're looking for those symptoms to decrease. Repeat chest x-rays are done in 6 to 8 weeks to assess for resolution also. Additional therapies, really important. We want to give them oxygen because it's already hard for them to breathe. And like Maria said earlier, their lungs are not allowing them to get any oxygen. So we're going to give them oxygen. We're going to give them analgesics to release that chest pain. We're also going to give them antipyretics to treat that high fever that they may be getting. And then obviously we're going to want them to rest. Activity also is very important because it gets those secretions moving and we want them to get out. So we want them to cough it up. And just ambulation helps that. Nutrition therapy is also very important. Hydration prevents dehydration and it actually loosens the secretions that we were just talking about. Weight loss often occurs in these patients. Sometimes body image can also be a problem. But with that weight loss, we're going to be giving them supplemental nutrition. So small frequent meals are easier for them, and also we're going to offer foods that are high in calories and nutrients. So health promotion in pneumonia. We are going to teach the patient to practice good health habits. So washing hands, proper nutrition, exercise, all of these things that you hear the doctors tell you, they actually matter and they're very important for your health, especially those people who are prone and are at risk for pneumonia. We want to place patients that have altered consciousness in a sideline position as well. So acute intervention for pneumonia. We're going to be collecting those specimens, oxygen therapy, hydration, breathing exercises, ambulation, and therapeutic positioning. So depression is a very common side effect, you could say, of these people with pneumonia, just because they're limited in what they can do and the interactions that they can have with other people because they are contagious. So usually they are isolated. So to add on to this information, we're going to talk about the financial burden that this puts on people and their families and society. And inpatient management is arranged from $39,000 to $113,000. Outpatient management is $4,000 to $31,000. So obviously our homeless population is not going to be able to pay for this, and that's going to be coming from our government and insurance. And some people might not even have that insurance. So very large financial burden here. We also have locations here in Houston. Bright Star Care is a long-term facility. It has skilled nursing care, and they also have respite care. And they are located on Northwest Central Drive. We also have the American Lung Association, and this is a great support resource for the families of these patients who have pneumonia, and it's located on North Loop West.
Alright guys, so that was for Bid on Community Acquired Pneumonia. Our goal for this project was to educate the public, or us, the HBU community, so that we can go out and when we see these people, we're able to teach them about this disorder and help them in how to overcome it. Thank you for listening.